Hello, everyone. This is Lynn Cremando for Yoga U Online. Today, I am so pleased to be here with Lillah Schwartz, who is the author of Healing Our Backs with Yoga, an essential guide to back pain relief. Lillah has been practicing yoga since discovering Iyengar yoga in 1979, and she was blessed to be studying with the master, Mr. Iyengar himself, as well as some other really great teachers. She's been teaching since 1981 and held an Iyengar teaching certificate for 23 years before branching off on her own. In addition to yoga, Lilla brings a strong background in movement, anatomy, physiology, and the sciences into her work in the studio. So her book merges those scientific pieces with, of course, the philosophy and the lovely, gooey yumminess of yoga. Lilla opened the first full-service yoga studio in Asheville, North Carolina, and ran it from 1981 to 2013, when she stepped away to create other projects. But she still teaches group classes today, works with clients. She runs lots of teacher trainings and retreats, and she's also produced a couple of therapeutic DVDs for people with structural pain, such as shoulder pain and back pain. So welcome, Lilla. So glad that you're here with us.
Good afternoon. A pleasure to be here. Thank you.
So we've just touched a little bit on your book, that it is an amalgam of your science background and your yoga background, both very strong. And you've worked with hundreds of people, helping them conquer back pain, but I'm suspecting that there's a little bit of a personal backstory here that perhaps nudged you in that direction of therapeutic yoga. Would I be correct in that?
Yes, you would definitely be correct in that.
Would you mind telling us a little bit about your evolution?
Sure. It all started, I love horses and I love yoga, and it all started going down with a horse, where I severely busted my tailbone, and it set up a whole asymmetric pelvis bit that not only gave me lower back pain, but SI joint pain, knee pain, shoulder pain, and then there was a mild scoliosis in my neck, which contributed to the neck pain. So there's been a very intimate relationship that I have with working with structural misalignments and how to harmonize them so that we come to a place of great functioning. And I'm probably a testimony of my own work, no hip replacements, no knees, like that.
So you were your first client.
I was my best client. and my busted tailbone was my best teacher ever.
Not your favorite teacher probably, but your best teacher.
It was my best teacher, and it took time to, a certain level of maturity has to come where you recognize that this is the structure I have, and if I perform my yoga this way, I can be really strong and pain-free, but I have to be careful not to do it that way. So it is a good teacher, and it gives me a breadth of experience to share with other people.
So you've worked with quite a few different structural issues in your clients. Are there some main themes? Like, what are some of the things that, would you say, contribute mostly to back pain, or what do you see most often?
Well, there's two questions there. What kind of clients am I teaching, and what kind of conditions do they have? And then what's the best way to approach it? So there's sort of a double question. I work with all kinds of people with back trouble. The weightlifting man who has 3 herniated discs because they're too muscle bound and contracted, and they need to learn to stretch out and lengthen their spine and keep a certain amount of range of motion and flexibility. Often women will have weakness in the pelvic floor or weakness in the gluteal muscles somehow that keeps them unstable in their pelvis, and so the lower back has to compensate for the instability of the pelvis. I've worked with scoliosis. I work a lot with scoliosis. I've worked with spondylolisthesis. I've worked some with stenosis. Stenosis is the hardest one um, because the bones are, there's calcium being laid down and additional bone being laid down. And you can't make that disappear, but you can give some relief and you can give some preparation for the body, if you will, in case a person is going to have surgery. You
Mm-hmm.
can give some preparation that makes their surgery more successful.
What would you say makes yoga uh, a really good, viable option for this kind of pain?
I love this question because the beauty of yoga is that it connects one part of the body to another. So you can discover in your practice, not only is your big toe mound connected to your inner groin, but it's also connected to the origin of the psoas muscle. So your legs start where the psoas muscle starts, which is at T12, right?
Mm-hmm.
And then when you expand your arms and really work the arm area, then your arms connect to where the legs connect at the beginning of the psoas muscle. So it's the beauty of how yoga can, especially alignment yoga, when you understand alignment,
Mm-hmm.
can lead us to those connections in our body so that the fluidity can be brought back in to how we move through our life.
Mm-hmm. So we often say this in my tradition, that we deal with the person and not the condition. And it sounds like what you're saying is you're looking at a whole body. You're not just looking at a lower back.
Right, right. You know, if someone doesn't know their body and how it works, then you have to start with baby steps, because then what you have is you have a puppy. The body is a puppy that's not trained. Once you can, so you have to start with the basic alignment, basic connections, how to use the breath, um, how to do a simple sequence of poses that is anatomically balanced. And then once you can train in the fundamentals, then you can lead people to the
Mm-hmm.
broader, bigger connections. So, you know, students who come to my classes, if I start a 6 or 8 week back care class, they'll come in, maybe I get a range of people anywhere from on a scale of 1 to 10 being as objective as possible, you
Mm-hmm.
know, 1 being no pain, 10 calling 911.
Mm-hmm.
So if we do an objective, you know, you have people with a 2, 3. If somebody tells me they've got a 5 or a 6, I start paying more attention. If they've got a 7, I really pay close attention. Because when someone has a joint dysfunction, because the dysfunction in the joints is a very small space.
Mm-hmm.
It's a tiny space. It doesn't take much to affect it, right? And if somebody has a strong dysfunction, if their alignment is off just by a little bit, they can get that negative pinch or that bite or increase the inflammation on that herniation rather than relieve it and allow the inflammation to start to recede. So we start with really basic things. You build gradually, but over 6 weeks, most people will get down from a 4 or 5 or 6 to a 2 or 3.
Mm-hmm.
If they need more special attention than that because they're not progressing in class, then I see them one-on-one privately so that their mind can start wrapping around how to live in their body, how to listen to their body, how to be their own best friend. That's my favorite statement, how to be your own best friend by knowing the map of this beautiful body that we have.
You know, in your on your website, there's a really lovely page where you pay tribute to all your teachers.
Mm.
And I think that is just very eloquent. And one of the things that you said about Mr. Iyengar that really struck me, and it's reminding me, what you're talking about right now reminds me of it. So I'm going to ask you to talk a little bit more about it. But it was that he compelled you to practice, investigate, and observe the result of each action, developing subtle insights and connections of body to mind and mind to soul. That piece of investigate, and observe the results of each action. It seems like a very important component in what you're talking about right now.
Well, it is. And I think the challenge as a yoga teacher and as a teacher trainer, training other teachers to have a good skill set, the challenge is, how do you language the pose when you teach it? And do you give your students enough time after the pose to observe what's changed? It really is that sense of action and reflection. Action and reflection. I think that's probably, and then it's practice. And it's practice and listening and learning to listen to the body as an intelligent organism. Yeah.
And then the second part of that statement had to do with sort of the mind-body connection. When you're working with structural pain, can you talk a little bit about the importance really of that mind-body connection?
Well, again, in the beginning, you have to keep it really simple. And the simplest thing is that if you're breathing, if you're focusing on your breath, and it's a long, smooth inhalation and a long, smooth exhalation, then the mind is captured by the breath. So the mind connects to the breath connects to the body, and then the body communicates back to the mind through the breath. So it all has to do with breath.
Lovely.
Yeah.
Yeah.
The magic ingredient.
Yeah. Okay. We're going to move from lovely to the slightly controversial.
Oh boy, oh boy, oh boy.
Because you use the word alignment a lot, and Iyengar is the alignment yoga. I've been seeing a lot of controversial or provocative chatter on the various internet places. And they have to do with the idea that alignment can be this rigid, structural thing that is external. So I'd like you to talk about what you mean by alignment. Do you know what I'm saying about?
I do.
What you're speaking, controversy.
What you're speaking about is rigidity of mind. And there are plenty of people who teach Iyengar yoga who suffer from rigidity of mind. And, part of my studies, I had a close encounter with Mr. Iyengar one time, which really propelled me forward. I taught at a conference, and he came by one morning. I had a group. I had one class on my own, and I had worked hard to prepare, and I was pretty much the green teacher in the crowd. And I had 35 people in the room. There were 5 back conditions, 3 knee surgeries, a shoulder injury, and a man with cerebral palsy. And I had never worked with a man with cerebral palsy before. So I did what I saw my teacher do. I put his back against the wall. I put a chair up in front of him, and I turned around and I taught the class I was teaching. Now, I felt pretty confident that I had worked hard on that class, and that the way I was going to teach it, that no one was going to get hurt, and they were going to experience something about the connection of yoga and the mind and the breath and etc., right? And Guruji, known affectionately, walked by with his entourage, and he chewed me out because I wasn't helping the guy with cerebral palsy. And, without making a long story really short, I was challenged in that moment, and I said, gosh darn it, never is Iyengar ever going to walk into one of my classes when I cannot look at him and say, yes, I am helping these people in a brilliant way, and they're improving because of their yoga experience. So I went on and I spent 10 years studying with Eric Small, who had MS. And I learned all about how to pay attention to other subtleties that a lot of people who do the straight Iyengar formula don't get those, because they don't allow themselves to feel that each joint can move 4 directions minimally. And if it's your spine and it can rotate, then it's more than 4 directions, right? So that's where my injuries and my pain served me really well, because I had to figure out, what are the subtle movements? How can I change this alignment? So the rule of thumb is this: alignment's important. Go with the lines whenever possible. Deviate from those lines only in those cases when the deviation creates a greater connection to the whole. It's a really deep question that you've asked me.
Mm-hmm.
Takes me months to get this across to teachers and teacher training. It's a really deep question. So there must be flexibility, there must be adaptability in the alignment. So just because you can see someone goes up like this and they're really trying hard to get their arms up and their elbows are bent, but they've got scoliosis. As soon as I do that, I'm locking up the muscles on my back body,
Mm-hmm.
and it's just going to clamp down on those facet joints and generate pain. So I say to them, lower the arms, wrap, open the elbows, feel the line, lift the back ribs, and feel yourself create length in your spine. If you can't do it in this position, do it in this position. So there has to be adaptability where the pieces can connect. I'm just going to leave it at that.
It does sound, as you're speaking, though, that when there is the adaptability and the pieces connect, that there's a real somatic sort of integrity to the individual's alignment, so that each person's integrated alignment may be a little different, but it's authentic.
Right. There's finding that authenticity and sensation. When you say soma, it's like the sense of sensation. What are the sensations that you're having? So when I teach, I'm interested in the fluidity of structure
Mm-hmm.
and what can help create that fluidity. So if a person has really destroyed their lower back and they've got herniations for whatever reason, they don't have fluidity in their hips, and they may not have fluidity in their shoulders. So, you have to start with the base and slowly help them create that fluidity, that flexibility. But at the same time, muscle structures can also be weaker. The fascia, the muscle structures can have a weakness in them. For instance, you and I sitting at our desk right now, all the time that I spent writing my book, sitting. People who sit a lot, people at Yoga U who sit and make these wonderful videos for everyone. That's a liability. Sitting too much is a liability because there's a weakness that comes into the lower back. So, there's different poses that you need to do on a consistent basis to counterbalance what your life experience is. So that's another flexibility about how to sequence poses together.
Also sounds like you've got to factor in compensation patterns, because if I've been sitting all day, I probably am compensating and transferring some of my psoas work, subcontracting it out.
Right, so to keep it simple, to keep the study simple, if we just look at muscle structure, we know that there's something called reciprocal inhibition, right? And what that means, simple, plain and simple, if I contract one muscle group, automatically the muscles on the other side are going to relax. So if somebody's having back spasm, lay them on the ground, teach them a couple little tummy curls that don't irritate their back, the ones that don't irritate, the one that they can do, teach them what they can do, and let them curl a little bit, and 5 minutes later, their back pain's gone because the spasms are gone. So reciprocal inhibition can be relied upon as a tool for the practitioner and for the yoga teacher. I have a short story. Can I tell you a short story?
Absolutely.
Okay, I had a short story. I had this fellow come to me one time. He was brilliant in Greek history and philosophy and taught at Omega. He was a big name, right? And he came in and he had this pain in his neck. And he was so so crisp in his consciousness, so vast in his consciousness, that I felt like I was in a snowstorm with what the information he was giving me. I felt like I was in a snowstorm, and I'm trying to find the way in to help him get rid of his pain, to help get some relief. And so finally, I got him lying on his back just to press the back of his head into the floor and let go. Press it into the floor and let go. Press it into the floor and let go. And it released the tightness in the front of his neck just enough for the pain to disappear. And I went, that's it. Okay, if God sent me a sign, he sent me this person, never again will I doubt that reciprocal inhibition always works. Okay, and it's pretty simple because you can just look at the muscle structure. You don't have to be, and that will lead you, that would lead a student, that would lead the teacher in their practice gradually to those deeper connections. But you can start with something so simple and employ it to help somebody else. And I think that's really important.
That's really beautiful. Now, you have a very, very strong science background. In your teacher trainees, and even we're talking on a website right now where people are meeting you for the first time, but how important is it for a yoga teacher to have a grounding in anatomy, physiology, kinesiology? How important are those things in a teaching practice?
You know, I do believe that some of the physical sciences are important. Mm-hmm. But I also know that there's a diversity in yoga that I wouldn't want to diminish. So it's like silver sneakers yoga, right? Mm-hmm. It's such, forgive me, it's a little bit like pablum. It's just like so simple. You can't even have a person put their head down below their hips. And that's like, oh God, I'd never want to teach that. But that's for the insurance companies, mm-hmm. because they don't know who has high blood pressure, what their eyes are doing, blah, blah, blah. So it's for the insurance companies. So, but in a general yoga class, I do think it's important for people to have a basic understanding of anatomy. I think if they have a good training program and they have a regular practice, some of the other pieces will come in. But I think a baseline of understanding anatomy is really important. As far as physiology goes, when I do a new pose and the muscle cramps, why did it cramp? It cramps because it's weak. It's either stiff and cold or stiff, cold, and weak. So sometimes you have to warm the body up a little bit, just like it's an athletic endeavor in some sensing because you are living in a physical body, mm-hmm. right? So easy things to warm up, using the breath, easy things to warm before more challenging poses. But then understanding where the anatomy comes in is that you can understand how to counterbalance a sequence. So that at the end of the sequence, we're supposed to be neutral. We're supposed to go into Shavasana in a neutral state so that we can really relax the body-mind. And it helps. It just helps a lot.
So I know that your book is based on many years of practice, and you've poured sort of heart and soul, lots of stuff into that. But I also know that you've developed a course for Yoga U Online called Yoga for a Healthy Back. It's a 3-part course. The first part is key elements and practice for back pain relief. So a lot of this will be covered, but can you talk about that course?
Sure. So the way the course is set up, it's set up with a PowerPoint presentation. It's a long one, it's an hour long, but what we love about recorded material is we can stop halfway through and start again, or we can listen again, right? So I'm really grateful for this recording that. So we're going through the important things to understand about structure and back pain and alignment, how to relate to pain, what is positive, negative, and post-exercise pain. People don't talk about pain, but everybody in a pose needs to know about it because, oh, are you sure that's a good pain? And how do I tell the difference? So I talk about that in the lecture portion, and then it's followed by 4 30-minute practice sessions, and it's set up progressively. So someone would start with practice session 1, become comfortable there, then go to 2, from there go to 3, and from 3 go to 4. So how to progress from a place of having back pain, first finding those poses that are going to give you relief, gradually increase range of motion, so gradually expand flexibility and range of motion, and then begin to go to the poses that are more tonifying, toning the back muscles, toning the lateral muscles, right? So you don't build strength. It's a different way. The yogic way of going about it, in my estimation, is different from sort of the typical exercise physiology way of going. So what I do first with people is get them out of pain. Mm-hmm. Once you're out of pain and the inflammation is reduced, then you can start expanding a little bit, creating some more flexibility, doing the best poses. And I think the poses, that course and the poses I included in that course are the baseline poses that I've been teaching people for 35 years. And I consistently start with a group with levels of 4, 5, 6. At the end of 12 weeks, they're down to a 1 or a 2. So, and they've learned how to manage their back pain. Mm. And that's really what I'm sharing in that course. And I think it's going to make, I'm so excited that more teachers will have access to it, because all of my graduates who have employed my techniques in their classes and followed some of the sequences from the book, I'll email me back, thank you, my clients are all getting better, thank you. So that's great. And the book is divided into 3 sections. Mm-hmm. So it's like, if you've got a back condition and you've got a high pain threshold, first of all, get a release from your doctor, your physical therapist. Then go ahead and start the first section of the book. Stay with that first section for 3 to 6 months until you know you're pain-free. Then move on to part 2. And in part 2, you kind of build range of motion, start doing poses that create strength. And then part 3 is for people with an asymmetric pelvis, which is the next course I'm doing for Yoga U, the asymmetric pelvis one.
But so the work that you're doing in this course kind of parallels what's in the book. There's backup in the book.
There's backup in the book.
Sounds like a ton of useful information and practices and sequences that people can just pick up and start to use for themselves too.
Right.
The yoga teachers go hither, tither, and yon and demonstrate a little bit here and a little bit there, but we get backaches too. So it sounds like
right.
a win-win.
It's very interesting how many yoga teachers really don't know how to keep their back safe.
Exactly.
And, and so it's going to be good for them as well. I think that one of the beautiful things about the book is that each little sequence that I made, most of them are about a 20 minutes, 30-minute sequence. Mm-hmm. About each mini sequence can stand on its own, and the student doesn't have to think, oh, am I sequencing my poses together in the right way? What's the guidance? No, this is it. Do this sequence. And then they may come across one pose that's no good for them. So they skip that one and still do the rest of them, come back and try it another time. So it's a great book to really for teachers and students to work together.
But it also sounds like the course that you've created is going to teach you how to sequence and the theory behind the sequencing. So
Right.
that's, if you're not looking for a cookbook, you want to be a cook. The course
Right.
is also going to be
Right.
extremely useful. Well, Lilla, thank you so much for sharing your wisdom, and I'm looking forward to tapping into your course.
Yes, thank you. I look forward to sharing it with many people.
Thank you. For Yoga U Online, I'm Lynn Cremando. Thank you for joining us, and we'll see you again very soon. Bye-bye.
Namaste.
Well, yoga has really been at the forefront, and you've certainly been working on this for many years, but it's nice to see yoga being recognized as a healing modality by Western medicine in some of the evidence-based material that's starting to emerge.
Indeed it is. You know, just recently there was a study, 2017, by Boston Medical Hospital, and what they did was study 320 racially diverse, low-income population, all who had chronic back pain. And they did a really broad study with yoga, physical therapy, and other modalities. What they discovered at the end of the year, that those who did yoga or physical therapy had a 20% reduction in the use of pain medication. So at the beginning of the study, 70% of the people were taking pain medications, and at the end, only 50% were taking pain medication. And that's something that you and I know about the practice of yoga. When you do yoga, it works, and it's a management situation, so you have to be consistent with the practice. So it was a great study because it took place over a year. I really appreciated that.
Yeah, and I think more of these studies are emerging. I know that in 2005, there was also an NIH study on back pain, and that was maybe the first really scientifically toothy study. But what's really nice is that the American College of Physicians is now recommending yoga as a modality for treatment of back pain.
And it's really wonderful. I'm glad to see the evolution of yoga in our culture.
I know that you have developed a course for Yoga U Online, and it's based on this material called Yoga for Healthy Backs. Is that right?
Yes, that's correct.
And it's a 3-part course. Can you tell us a little bit about it and who it might be good for?
I'd love to do that, sure. It's Yoga for Back Pain, Part 1, and it's for the relief of discomfort, back pain. So the first PowerPoint presentation, there's an hour-long PowerPoint presentation that I share some information about the anatomy, physiology, alignment, how to work with pain, positive pain, negative pain, how to tell the difference, to help people get started in a good, solid yoga practice to manage their back condition. So I think it's excellent for practitioners as well as yoga teachers, to help them understand some of the ways to approach yoga and apply yoga for the management of back pain.
Yeah, it sounds like the really useful will be those sequences that you developed.
Yes, and the sequences are progressive. So there's 4 30-minute sequences, and each one of them progresses from fundamentally what to do to get relief, how to start building range of motion in your body, and then how to start building strength. So they can be repeated, or a person can switch from one to the other anytime they find the need to do that to help them on their journey.
Well, Lilla, it sounds really useful. I'm excited to see it. And I want to really thank you for sharing your wisdom today with us, the Yoga U Online family. And for the Yoga U Online family, I want to thank you for joining us. And we will see you again very soon here on Yoga U Online.
Wonderful. Thank you so much.
Thank you. Bye-bye.
Okay. Namaste.